Hi there, Dr. Lisa Lasko, acupuncturist here. Welcome back to Postpartum Series Part 6. And today I'm going to focus on clogged ducts and mastitis. And this is something I actually experienced myself. And I knew about clogged ducts and mastitis because of having so many friends who had had babies in the last couple of years. And I knew how to actually treat it because of actually a couple of these people were actually practitioners themselves, so had told us some things to have on hand. And there's actually an herbal formula that we always have that we give to patients, and I had it ready to go. So I want to just talk about a little bit first about what is a clogged duct and what to look for. So this was something I was really scared of. I didn't know. And that's another part of the early breastfeeding days that my midwife said, like, make sure you do XYZ and make sure you properly unlatch baby when you go to, switch to the other side and all of these things. And like, well, don't do this because you could get a clogged duct and you could get mastitis. And it's really overwhelming, especially in those first 6 weeks postpartum, because you don't really know what to expect or what will happen. Like, you're really just focused on, like, okay, let me feed my baby every 2 hours, and you're so tired. So first of all, a clogged duct is basically like a milk duct in the breast that gets clogged up with, it's sometimes frequent breastfeeding. It could be not breastfeeding enough when you start sleeping a little bit more. And it creates basically like a painful bulge. It can be caused by wearing too tight of a bra. Just for I think it's also just the amount of that you're breastfeeding in the beginning, especially. You're very overtired and very depleted. And from a Chinese medicine perspective, it's another type of stagnation. And stagnation is something that I've been talking about a lot lately. And it comes up in a lot of different ways. I would say in the case of clogged ducts and mastitis, it is basically the qi and blood. So the blood being substance in the body, the qi is what moves the blood through the body. So anytime the qi stops moving, blood stops, and it creates basically a clump and what we call blood stagnation in Chinese medicine. So qi and blood stagnation kind of come hand in hand. It's the same thing with a clogged duct, which can also lead to mastitis. It basically is a stop of the flow of energy in that area. And with breastfeeding, there's so much moving through. The milk is moving through so quickly, and the body is producing it all the time. So it creates that clog or inflammation that leads to pain. So it can feel really tender. It can actually feel like a physical clump or like a little mass in the breast. That's how it felt for me. And it's painful. And so, in the case of clogged ducts, if you get them really frequently and you don't resolve them, they can lead to what's called mastitis. And mastitis is basically a very intense inflammation of the breast. And mastitis, if it's not caught or not treated properly or quickly enough, can lead to infection, can lead to breast abscess, sometimes like not being able to breastfeed babies. So it's really, really important at the very first sign of feeling a clogged duct that it gets taken care of. So for me, I had my first clogged duct probably about 3 weeks postpartum. And I actually remember still very clearly, very vividly, that particular day, I was feeling a little stressed by a situation. We kind of had an outside situation we were dealing with. And I remember right before I had to leave my house, actually, and I was really not going anywhere at that time, but I was like, oh, I'll just run out real quick with my husband. And I remember I felt the clump in my breast, and it was really sore and really painful. And I remember I went to hug somebody and bumped, and it was so painful. So luckily I had really good support. I had access to a couple of different lactation consultants that gave me some insight, and like I said, friends that had told me what to do. So luckily, I think I already had some sunflower lecithin, and that's a really common supplement that people use. And so sunflower lecithin is just a supplement. Legendary is the brand that I used. I bought it, I believe I bought that one on Amazon. And when you get a clogged duct with it, it gives very specific instructions. I think it's 4 to 6 capsules. And then you can also just take it for maintenance. So actually, after my first clogged duct, I just started taking sunflower lecithin just regularly, 2 capsules a day, just to kind of help with my milk flow and making sure I wasn't getting the clogs. In addition to that, they say don't stop breastfeeding, or if you're pumping, don't stop pumping. And that can be really hard because it's so tender and painful. But babies actually can suck the clog out. So that's why they say don't stop. But it can be really tough. You can also do like lymphatic drainage massage. So I kind of did a combination of all of those things because my baby was still only 3 weeks old. I hadn't done a bottle yet, so I really had to keep breastfeeding him. And then I looked up a video on how to do lymphatic drainage massage. So with that, a video I watched was really helpful. Doing it in the shower is really good because the heat kind of help move the clog out. And they say to open up your basically like the lymph ducts up in here by the collarbones. You can kind of massage those first, and then the armpit right here to open up those ducts. And basically the concept is that you're just moving the duct down and out through. That's why you're opening first, like massaging here, because all of those lymphatic drainage areas are in those areas, the nodes. And so once you open them up, you're just massaging, and you start with wherever you feel the clog and massage it out towards the armpits as if you're moving it straight out of the breast. You can also get there's like little massagers you can use, or like a little tiny one that are battery operated. You can use that. I just massage with my hand. You could also use a gua sha tool if anyone is familiar with gua sha. Put a little oil. But yeah, I just did it in the shower. I continued to breastfeed my baby. I took the sunflower lecithin, and then I also took an herbal formula. It's a classical herbal formula called Chai Hu Gui Zhi Gan Zhang Tang. And so my Chinese medicine people would be more familiar. Chai Hu is a Chinese herb. It translates to blueberry. Guizhi is cinnamon twig in Chinese medicine. And then ganjiang is a type of pan-fried ginger. And so it's a combination of that formula. I had it on hand, and so I started taking it as soon as I felt the clog come up, along with the sunflower lecithin, the massage, kept breastfeeding my baby. And then it's really hard with bras at that time in early breastfeeding days because you're leaking a lot. I think I talked about this in a previous video, but I always had to wear a bra and with breast pads, or else I'd be leaking all over. Or I'd be using my Trove, which is the passive collector. But it just is really tough at night in particular when you're trying to sleep. You can't really sleep with them on without them leaking. So I think that's where it's challenging, and I was wearing a bra a lot. So I suspect that's why I also got a clogged duct, because those tight bras create more of that stagnation and that clumping of the milk in the breast. So they say to try to take a break from wearing a bra or wear a looser. I really like Old Navy has some really nice nursing bras that are really light. They're not super tight or constricting. So if you need to wear a bra, something like that, or even just like a tank top that doesn't have a bra in it that's a little bit tighter is nice, because you can still get the breast pads in it if you're leaking. But it's really hard. So I have so much compassion and empathy for it. But really the best way to treat a clogged duct is early treatment, doing those things. I actually have had probably 2 or 3 clogged ducts, and I had another one later on, and it was in the middle of the night. And I remember that particular night I was breastfeeding in the night and felt it. And I was feeding baby on one side, and then I ended up pumping on my clogged side, I think because he didn't want to eat enough. And so I took my herbs. So I'm up at 3 a.m, taking my herbs, taking my sunflower lecithin, pumping, holding my baby. It's a wild time. And so I have women are so amazing. I have a lot of empathy. I know it's really hard. Hang in there, anyone suffering from clogged ducts or mastitis. So again, mastitis is what you're wanting to prevent. And it is okay if it happens to you. Typically, to treat mastitis, you do want to talk to your doctor or talk to a lactation consultant. You need to get antibiotics if it turns into mastitis most of the time. And it can lead to fever. So some people end up taking some ibuprofen or Tylenol to help with the fever, but usually antibiotic is how you treat it. The herbal formula that I mentioned also can treat mastitis or clogged ducts. It's for both. It just kind of depends on how severe the case is. I would say if it starts to turn to mastitis, there can be like redness on the breast. It can be really sore and really painful. So obviously talk to your primary care provider. And if it frequently occurs, I know a lot of people experience it more so if they have an underlying condition, like a hormonal issues like PCOS or PMOS, sorry, uterine fibroids. I've noticed women have a tendency to experience it more frequently because you're more susceptible to inflammation and more affected by all the hormonal shifts that come with postpartum. And sadly, it just is really hard at that time, and you're not sleeping a lot. So you're just more susceptible to sleep deprivation. And in Chinese medicine, that leads to blood deficiency. Women who've recently given birth also are more susceptible to blood deficiency. When there's less blood, it creates dryness, which leads to that stagnation that causes that clumping and that clogged duct or mastitis. So really key to treating it is just early treatment. So as soon as you see signs of a clogged duct, I would, one, do these things that I mentioned in the video, talk to a lactation consultant first, and then if it's really bad, I would say talk to your primary care provider. There are some other things in terms of Chinese medicine for those that want to take a more natural approach. Aside from the herbal formula, you can get in with your acupuncturist or a acupuncturist near you. There is a technique called breast cupping that you can actually use the cup sliding over the breast to pull out the clogged duct or the mastitis. It can be tricky to do that if you're really sore and inflamed, but it is a really effective technique that I can do here in my office. Acupuncture can also help if you don't want to do cupping necessarily. There's a lot of techniques, but really early treatment is really key here, and regular treatment. Especially if you experienced it, it might continue to come back. So just continuing to come. For me, in my office, in my practice, I'm here for women in the earliest postpartum days. I actually will do house calls if needed. If they're, it's too early or I just don't want to leave baby yet, I can come to your house, or you can come into the office and we can do any and all of these techniques. You can also do what's called a rodent soak, where you're leaning over an Epsom salt bath. It's kind of all of these things in conjunction. And one other thing, there is conflicting information about whether to do ice or heat for clogged ducts and mastitis. I believe it used to be heat. Now they say ice. I would say once it gets to mastitis, it's really inflamed, so you probably wouldn't want to do heat. Chinese medicine really always says no ice because cold getting into the body creates more stagnation. So for me, when I've had my clogged ducts, I've actually done a little bit of both. And luckily, I have a lactation consultant, acupuncturist friend, L.Ac with Push San Diego, and she's the one who told me, because intuitively, I was using what's called a Moxa hot pack. Moxa is Artemisia vulgaris, or mugwort in English, and I actually have packs that I put on, and I was putting it on my breast, and she actually said, be careful to not use too much heat because it can make it worse and the inflammation worse. Lanacin is another brand that they make nipple cream, but they also make these little hot and cold packs. It's like a little ice pack that you can put in your freezer, or you can heat it in the microwave, and they go in a little sleeve, and you can put that around the breast. So for me, I started with my little Moxa pack, and then I ended up switching to ice. I think the second or third time I had the clogged ducts, I ended up doing the ice pack first to cool, and then I would do my Moxa pack just for a little bit, kind of like that alternating 5 or 10 minutes. And I kind of just use my intuition most of the time, but that knocked it out pretty quickly. And then, on top of this, I had a lot of other health practices that I was doing to take care of myself. I was taking my base Chinese medicine formula, I was taking my placenta, all of those things keep doing. There are some other supplements by Legendary, like Pump Princess. There's other supplements you can use, like fennel. The mother's milk tea that people take, some will say that those can make it worse. So I would consult a lactation consultant around any other herbs. I'd stick to the sunflower lecithin, or if you see a Chinese medicine practitioner, to the herbal formula that they recommend, because it can be a little bit complicated if you're taking a lot of different things in terms of herbs and supplements. So those are kind of my tips for this video. If you have questions or comments, please feel free to reach out or directly message me on Instagram at Dr. Elise Lasco. Reach out through my website or comment in this video. And you can find me at www.fernacupuncture.com. Thank you and have a wonderful day.